Hi everyone, and welcome to my presentation. This is the nurse's role in the transformation of modern healthcare. I chose this topic because it seems pretty appropriate based on what this whole program's been about, just how the BSN nurse functions in the healthcare system, and especially it seems to pertain to how our healthcare system is currently evolving, particularly after the Affordable Care Act and the growing population of patients older than 65 years old. So without further ado, let's jump right. It's no secret that the healthcare system has been greatly strained in recent times by a multitude of factors in our nation. Some of these demands are due to a growing population of aging patients with chronic illness, unsustainable costs of care, new government policies, and obsolete health information systems. The fundamental way in which healthcare is delivered must be transformed to meet the needs of our patients in this modern healthcare system. The skilled nurse is a unique position to help guide these changes needed to achieve a more optimal and sustainable healthcare system. Nurses must assume the leadership role more than ever to ensure that quality care is being delivered to patients. The American Nurses Association states that nurses, with their unique skill set, philosophy of care, are the provider of choice to lead, manage, and participate in the care coordination in groups of patients. The baccalaureate-prepared nurse has the knowledge and skills needed to provide effective patient-centered care and to help navigate the complex system of healthcare. By serving this invaluable role, the skilled nurse helps the patient to maximize their health outcomes while also minimizing the costs associated with healthcare, a crucial goal in this modern era. So here you can see a graph just laying out the costs of Medicare and Medicaid from 2016 to 2019. You can see starting in 2016, the costs were already pretty high at $3.3 trillion. And then by the following year, they went up to $3.5 trillion, up to $3.6 trillion in 2018, and then lastly, $3.8 trillion in 2019. We currently don't have the finalized data for 2020's figures, but they are estimated to be around $4 trillion right now. So as you can see, this is a quickly growing issue in our country. It's just the costs are getting out of control and something needs to be done. The need for a fundamental change in how our healthcare system operates has been realized for some time now. Our current model of care is too costly and wasteful. Estimates that 30% of our healthcare spending can be considered as waste, which totals around $760 billion annually. Studies link the wasteful spending to failure of care delivery, failure of care coordination, overtreatment or low-value care, pricing failure, fraud, abuse, and administrative complexity. In addition, caring for our growing elderly population who are more likely to have one or more chronic conditions has become a concern as this patient population requires the largest number of medical services. The traditional approach to healthcare has been costly and inadequate. The leadership role is frequently filled by the physician who dictates most, if not all, of the patient's care. It is not uncommon for the physician to provide many unnecessary services to patients, primarily because this increases their profit. Care is often delivered in siloed facilities with little coordination between other members of the patient's care team. Many times, this results in repeated physical histories, diagnostics, and prescriptions, which are not only costly but can also be dangerous. This system has proven to be ineffective and too costly to sustain, particularly in our elderly patients with one or more chronic illnesses. In recent years, there has been a push for a transformation in how healthcare is delivered. In this new system, there must be a greater emphasis on patient and patient family-centered care. This means that we must provide care that corresponds with the patient's wishes, which often means promoting their quality of life rather than providing aggressive treatments. After the passage of the Affordable Care Act in 2010, there has been a much greater emphasis on pay-for-performance and value-based purchasing. This has created a demand for transforming the way in which healthcare is being delivered, which the skilled nurse is ideally suited for filling this role. The nurse most often spends time with the patient more than any other member of the care team, and therefore knows their patients the best. Because of this, the nursing role should be promoted as a role of leadership during care, and the care planning process. The nurse must coordinate with the other members of the care team to help ensure quality, cost-controlled, and patient-centered care is being delivered. So here is my Pico question. The P, or my population or disease, is the general patient population with an emphasis on patients with one or more chronic conditions. The I, or intervention, is the provision of patient care by utilizing the transformative role of nursing approach. Our comparison is the traditional approach to patient care. The outcome is an increase in quality of patient care. The time is varying depending on the nurse's education, facility policy, government policy, and the nurse's willingness to adopt change. So, in the care of patients with chronic illnesses, how does using the transformed approach to healthcare compared to using the traditional care model affect patient outcomes? Here is an overview of my literature review. The article Healthcare Transformation and Changing Roles for Nursing describes in great detail the issues with our current model of healthcare delivery and the need to adopt change. Specifically, this paper emphasizes the nurse's role in transforming how care is delivered and how the nurse is the best suited team member to lead this change. The article Evaluation of the Effectiveness of a Nursing Physiotherapy Program in Chronic Patients details the importance of collaboration within the care team to reduce siloed healthcare facilities. It also describes an already established system of care collaboration between nurses and physical therapists and their successes. The article Waste in the U.S. Healthcare System, Estimated Costs and Potential for Savings emphasizes a need for restructuring how care is delivered. These studies estimate that 30% of all healthcare expenses end up being wasted. The article National Health Expenditures 2019 also reports the significant increasing costs of healthcare each year and estimates Medicare and Medicaid expenses to have been over $4 trillion in 2020 alone. Clinical Leadership, Development, and Education for Nurses, Prospects and Opportunities cites complexity, chaos, high rates of change, serious safety and quality issues, and workforce shortages as a major need for increased education and leadership skills for the registered nurse. The article Utilization of Registered Nurses in Primary Care Teams describes how nurses are able to relieve some of the workload of physicians by taking on complex patient care in situations such as providing education, addressing patient concerns, and renewing subscriptions. To combat the current strain on our system of care, the skilled nurse will need to adopt the transformed role to improve quality of patient care and outcomes. This can be achieved through modifying how nursing is taught to nursing students, adjusting healthcare policy, and restructuring how healthcare is delivered in facilities. Education for students should emphasize the leadership role, the need to collaborate with the care team, and knowledge of nursing concepts. Healthcare policy should reflect the need for the nurse to take a leadership role in the care team, the need for increased collaboration between the professions, increasing positive patient outcomes through the utilization of the latest evidence-based practice, and transitioning to the paperless forms of documentation. Healthcare facilities need to recognize the importance of the nurse's role and promote opportunities for them to lead during the care process. To provide an effective transition to the transformed model of healthcare, there needs to be a couple of fundamental changes in how systems in place operate. Nursing education should be modified to incorporate the principles of the new roles of nursing. This could be done at the state or federal regulatory bodies like the Board of Nursing to advocate for educational reform. Federal policy has already promoted the implementation for the transformation of healthcare through the Affordable Care Act, and this does seem to be driving progress towards this goal. However, there may be more that could be done at this level, such as implementation of a universal patient electronic medical record system, which would allow for seamless transitions of patient data between the care settings. Of course, passing such legislation is not easy due to opposition to change and risks to stakeholders. Research findings should be clearly presented to stakeholders in simple terms to emphasize the need to adopt change. Adjusting federal policy could also be used to promote opportunities for leadership roles to nurses in healthcare facilities. A few outcomes I would expect to see if these measures were fully adopted into the nursing practice and healthcare policy would include an increase in positive patient outcomes, a higher degree of patient satisfaction during care, and reduced overall spending on healthcare services. To evaluate if these outcomes were being met, data from hospitalizations should be collected to determine the rates of adverse or sentinel events that occur, such as the rate of collapses, CAUTIs, falls, or anything else like that. Surveys could be sent to patients to inquire whether or not their health needs were met during care and what their overall experience was like. To assess if reductions in healthcare spending had been met, we could examine the annual federal budget of Medicare and Medicaid expenses to determine if spending actually had decreased or even increased. A few limitations to collecting accurate data may include, but are not limited to, the accuracy of patients' charting, unknown underlying factors surrounding sentinel or adverse events, bias, and waste of healthcare dollars from insurance fraud claims. Any findings from this project could be recorded and presented in a reputable research journal or article. This would provide for easy to read and understand literature that other researchers could utilize to further their own arguments for transforming our current approach to healthcare. For obtaining contact hours for continuing education through a nursing organization, I would likely need to first present my findings to their board for review, and if approved, I could give my official presentation in front of their organization and make my case for the need for a transformed approach. In my current job, I have learned about the great need for collaboration between the care team from a patient's physical therapist. From his perspective, having the nurse work with him during the patient's recovery process is crucial in helping to improve the patient's outcome. Oftentimes, this only includes something as simple as continuing their prescribed stretching or weight-bearing exercises once a day and promptly notifying them of any changes in the patient's condition. He states that patients with nurses who choose not to work closely with him or not at all will often suffer from lower quality outcomes from their care and a greater risk for adverse events. According to my patient's PT, he believes that many patients could greatly benefit from seeing a PT during care rather than only being seen by a physician. Whereas a doctor would typically prescribe a certain medication to manage the symptoms of pain, from whatever condition they're having, the PT will target the underlying cause and prescribe exercise, stretches, and lifestyle adjustments to correct the underlying issue. Many of these problems can often be solved by simple realignment or adjustment of a certain body structure that contributes to their pain. He has even helped me once when I was experiencing pain in one leg, which he determined was related to a misalignment of my hips, causing one leg to slightly protrude further than the other, and it consequently increased wear on that side and just made it uneven during when I was walking and running and stuff. Through a few basic routine stretches and exercises, I was quickly able to realign my hips, and the pain was decreased immediately. So they definitely make a huge difference in care. So to sum it all up, the need for a new approach to how care is delivered in the U.S. has been realized for some time now, and it's quite apparent that we as nurses are pretty well suited to help guide this change. However, for this to occur effectively, nurses must be trained and encouraged to fill this new role. Nursing education must be modified to teach these concepts, and healthcare policy must reflect the need for nurses to step up as leaders. Nurses who provide team and patient-centered care will not only improve patient outcome, but will also help to decrease overall spending related to patient care through increased quality of care and reduction of adverse and sentinel events. Our patients will not receive acceptable outcomes, nor will our nation be able to afford our current projected healthcare expenses unless such measures are adopted and fully implemented in the near future. And that's all. Thank you for watching my presentation, y'all. Good luck to everyone else. It's been a pleasure throughout this program. See y'all.